Welcome to Wellness Wednesdays, a web series where we examine how COVID-19 has impacted our healthcare system and what you need to know as you re-engage with your physician and get the healthcare you and your family needs in 2022.
Welcome to Wellness Wednesdays. Today we're going to be talking about influenza vaccines and when's the best time to get them. So influenza we know circulates mainly in the colder winter months. We've been watching what's been happening on the other side of the world, and we do see that there's an increase in flu activity this year. We can expect to see even more as people's masks are coming off and as these big events like UT football games are happening. Everybody's super busy these days, and so I tell people if you've got a day to take the COVID vaccine and the flu, go ahead and get both together. You may feel achy, but that's your immune system working. This time of year is perfect because it allows your immune system time to create all of those antibodies. So September and October will allow you that time to prepare for the winter ahead and to prepare for those family gatherings, the Thanksgiving, the Christmas, the New Year's, the things that people have been missing for years. We definitely don't want them to miss this year for the flu. COVID right now is still being transmitted in our area, but we're not seeing the huge rise in hospitalizations that we feared. This can always change, and we're preparing for another wave this fall and winter. So we're really emphasizing that patients who are able to go ahead and get the bivalent COVID vaccine. Bivalent means that it has two different versions of COVID. It has the original and it has the Omicron. As with any vaccine, there can be breakthrough. You can still get a mild infection, but the COVID vaccine, your influenza vaccines will help prevent you from getting a severe illness, keep you from being hospitalized, and can help you keep from spreading it to somebody even more vulnerable. One of the things that we're seeing now is that many people who feared polio vaccines did not get their children vaccinated. And now there's an outbreak of polio in New York. Polio, as you recall, can cause lifelong paralysis. The vaccines themselves have changed over the years and now are safer than ever. So today we've talked about influenza, we've talked about COVID vaccines, polio vaccines, but there's also a new updated version of the pneumonia vaccine. So pneumonia vaccines don't mean you'll never get pneumonia, but they are vaccines against the most common kind, strep pneumo. Vaccines are public health's best investment ever. Think of the millions of lives we've saved with mumps, measles, rubella, hepatitis, and now COVID vaccines. I think that so far science has shown that these are very safe vaccines, and now we have one that's even better, that's updated to the most current variants that we have available. They've been proven to be safe and proven to be incredibly effective, saving millions of lives. To recap, now is the best time to get your flu vaccine. If you've got questions, I encourage you to talk to your primary care provider. For hundreds of years, this is the thing that has saved the most lives of anything that we've ever done in medicine. Vaccines have saved the most lives.